Hello, love. It's time to do our thing. Hey, everybody. Thanks for joining us on this Sunday afternoon. This is the pre-show, the preamble. We got a minute and a half of goofing around. I am Melissa Fox, and with me, of course, it's Dr. David Klein, because it's time now for Stages of Life Medical Institute's Stages of Life Radio, and we are live on the internet. So, hi, Dave.
Hey, how's it going?
Hey. It's going.
Well, I don't know. It's like Stages of Rage today.
What?
So before we go live, I got a little bit ticked off at the major health insurance carrier in the state of Florida.
Oh, dear.
Why would that be? Because they're the only ones that you can actually buy, individual health insurance from.
Mm-hmm.
So I got a medication I got my sweet wife on who was having 25 migraines, knockdown, drag out, puke on the floor migraines per month. 31 days, 30 days. She'd have 25 of these knockdown, drag outs. And so we found something that works for her migraines that she's had since she was 16.
Mm-hmm.
Pre-existing condition, note to self. So what is it called? It's called Aimovig. Marvelous medication, knocked out her headaches. Just knocked them out. Unbelievable. It's a miracle.
Okay, 45 seconds
Miracle.
to complain.
Okay, the complaint was that they didn't approve it. And then I had to appeal it. They approve it. So what's it cost? They'll cover $100 of it. And so the bill is $580 a month.
Wow, that's expensive.
That's
and we'll
a
talk
lot
about
of
that
money.
during the breaks. But right now, let's get the disclaimer played. It's just about time for us to make some radio happen. Okay? So, bye.
It's time for Stages of Life Radio with Dr. David Klein. Have a medical question? Call 407-422-1212. That's 407-422-1212 or text 23680.
Welcome, guys. Time for the show, ladies as well. I am Melissa Fox, hosting along with the man with the plan, the doctor with the degrees, Stages of Life Medical Institute's own Dr. David Klein.
Good to be here.
That was a pretty cool entrance,
That's
wasn't
very
it?
nice.
Yeah.
Okay, you must have worked that one out.
That
in
came right
advance.
off the top of my
I know
head.
you better than that, actually. Yeah, she can whip that stuff out like the pro that she is. She's done this for at least 10 years.
Oh, yeah, more like about 3 decades.
Yeah.
Maybe more, but not telling. So let's not talk about our age, shall we? Let's, today, actually, the phones are already starting to ring, which is
Cool.
great. I haven't even given out the number. The text line's wide open as well. 23680 if you want to text in a question to Doc. Sometimes it's easier to do that. And 407-422-1212 is the number. Plus, if you're watching us on social media, which we are on a lot of different ones right now, Periscope or on Facebook, just look for either Connections or for Stages of Life Medical Institute, and you're going to find it. Also, share if you care, because other people, if you like what you're hearing here, well, we do this for you and for others. So share that, get the benefit, the full benefit, right?
Why not? It doesn't cost me any more, decibels to do it.
Right, exactly. So I know that you wanted to start off today talking about cleansing, detoxification.
Yeah.
What the heck does that do other than take money out of my pocket?
And then it will. Okay. So the reason I want to talk about detox is this is something that we talk about usually twice a year. We'll do it after the holidays, okay, in January, perhaps, or we may do it in July after we start getting, through the first part of the springtime. Detoxification has a vernacular meaning. That is, I don't know. What does it mean? Well, it means a lot of things to a lot of people, which is kind of why I wanted to mention it. Detoxification is a biological process that is entirely misunderstood and it's entirely misdocumented. It's promulgated, it's promoted, it's pushed, in a particular kind of way by a variety of physicians, some of which do functional medicine, interventional medicine, chiropractic, nutritional medicine, nutritionists. We're going to give you a detox. And they don't even really know what tox is, let alone to detox something. So what does it mean to be detoxed? And what does detoxification mean? Your body expends a tremendous amount of its caloric needs. What is that? 80% of what you eat. The energy produced goes for detoxification, antioxidants, survival in a toxic environment, sometimes known as oxygen. You look at oxygen, well, it's necessary for life. 21%, you don't get it, it's a big issue. But if you put 40% out there, it would burn all of our lungs and we'd all develop pulmonary fibrosis and die. 30%, it just simply takes a little bit longer. So oxygen is very, very toxic. So people walking around with oxygen in their nose, there's a reason why that is a prescription item. Because if it weren't, people would be doing it just for the heck of it, and they would be doing damage to themselves. Oxygen is toxic. Well, what do you know? Okay, so what are we talking about with regards to detoxification? You have multiple systems in your body that are involved with excretion of toxins, detoxification. And you'd be shocked, probably, unless you've been a long-time listener, to know that the largest organ of detoxification in your body is not the liver. It's not the kidneys. It's not the eyeballs either. It's the skin. The skin is the largest organ of detoxification in your body. And yet we pay little or no attention to health of our skin. Truly. You'll end up with people that'll get Botox and Juvederm and all this stuff injected. Like, that does a lot of good. If you want to look like you've been sucking on barbed wire, it's marvelous. So what is it all about? Okay, you excrete a lot through the skin. You absorb a lot through the skin. The skin has the same permeability, roughly, as a screen door. So things you put on your skin can enter into your bloodstream. Things in your bloodstream, in turn, will, in fact, be sweated out. This is a fact. This is the way these things go. So you have to look at the skin as an organ of detoxification. Number two, again, it's not the lungs. It's not the liver, but it might be the kidneys. It might be the lungs, depending upon the circumstance. So I usually tell people that if you include carbon dioxide, the lungs would be the second largest organ of detoxification. But they do more than that. The lungs are also involved in detoxification. There's a tremendously, it's just a vibrant endocrine system within your lungs. And so when you start damaging with things like smoking, things like toxic environments, things like inhalationals that you just might do for recreation, it causes long-term issues. And then, of course, we've got the kidneys. They're involved in a certain type of excretion and detoxification, and the colon. So what is it all about? Your body has an orchestra, okay, 5-6 members in this orchestra that do what they do, individual pieces of music, okay, in order to end up with a final symphony, or at least a little tune, let's say. Your body is going to do what it needs to do. Any one of those breaks down, and you got a problem. So when you look at detoxification as a goal, well, how often do you need to do this? Well, the answer is on a daily basis. How often do you need to breathe? The answer is 16 times a minute. Okay, if I told you that your heart needs to beat, 60 to 80 times a minute in order to keep you going, but we're going to stop it for 10 minutes, then we're going to do it twice as fast and make up for it over 20, it doesn't work. You die, unless you're on a heart-lung machine. So what are we going to do? We're going to talk about detoxification and how do you go about doing it without spending stupid money and getting nothing for it. So we're going to go to the telephone here real quick and see what we've got.
Linda from Eustis. She's 66 and had a bad sore throat since March, chest congestion as well. And Linda, you say that the antibiotics are not helping?
Yes, I'm on Cipro and they're not helping.
Okay, so give me a general idea of what's happening. Are you coughing anything up?
Yes.
Okay, does it have a taste to it?
Not really, no.
Okay, is it thick or thin?
It's kind of thick,
Okay.
and it's been happening since March, and the congestion won't go away.
All right, do you have any dogs or cats?
I'm sorry, what?
Do you have any dogs or cats?
Yeah, I do have one dog, a German Shepherd. They're outside. He's an outside dog.
All righty. Okay.
But
Yeah, because you can in fact catch things from the animals. Okay, and this is where it gets kind of interesting. Okay, so one of the most common causes of chronic bronchitis. Chronic bronchitis is a cough that lasts longer than 6 weeks by some people's definition. When you end up coughing thick, tasteless sputum, as you're talking about here, it can come from an organism called Bordetella. Okay, Bordetella causes a disease called whooping cough or pertussis. In your pooches, it's called kennel cough. And this can be transmitted from a dog or cat to a human easily enough. I've had veterinarians catch this from their dogs within their kennels. It's actually kind of an interesting thing. So one of the hallmarks of Bordetella in adults is that you cough until either you vomit or you want to, because the sputum is so thick. So the way you can make the diagnosis with this, okay, is either you can go ahead and do a special culture for this, or you do this. You ask your doctor to change the prescription to doxycycline. All right, doxycycline. It's a type of tetracycline. You start off first day with 200 milligrams, then you go 100 milligrams a day for about 3 weeks. That usually squares it away. But along with it, you need to do something to bring the mucus up. If you don't get rid of the mucus, you're going to have this thing for another long period of time. So how long? It could be indefinite. My mom ended up with this. So N-acetylcysteine, sometimes known as NAC, you take 500 milligrams 4 times a day. And then a second magical medicine called guaifenesin, sometimes known as generic Mucinex. And you take 4 of those a day, so breakfast, lunch, dinner, bedtime. Lots of water. It'll loosen the secretions up. You can cough them out, but you want to be coughing to get the garbage out. Once it's cleared, you can end up with a persistent cough. It's a reactive airway disease, but that should square you away. Let me know whether this does this or not. If it doesn't, then we need to move on and start looking at things like tuberculosis.
This is Stages of Life Radio, brought to you by Stages of Life Medical Institute with Dr. David Klein. They're in the intersection of I-4 and 434 in Longwood. You can check out the website at Stages of Life Medical Institute. There's quite the directory there, whether it's the vitamins shop, which is awesome, the radio show, and you can listen to Dr. Dave just talk and talk and talk. Oh, yeah. We're also on Facebook and YouTube, Stages of Life Medical Institute. We'll be taking your calls, looking at the text line as well. The text line is 23680, and the phone is open at 407-422-1212. I am Melissa Fox. Dr. David Klein will be back in just a moment. It's Stages of Life Radio on News Radio, WFLA Orlando. Okay. Hey, I need you to refill my
Amlodipine.
Yeah, that one.
It's blood pressure medicine for everybody out.
Pharmacist laughed at me when I was like, amlodipine. She thought it. She was I thought it's very funny.
What it is, I need my blood pressure medicine.
Pretty much is what I was trying to say, yeah. Anyway.
Send me a text message.
I'll remember.
Because I'll forget in 20 minutes.
I'll forget too. So, hi everybody watching us on social media, including Twitch as well as Facebook and a couple of 5 places. We're also on Periscope and Twitter, and I think even LinkedIn. Who knows?
We're on LinkedIn.
We're shameless. Yes, we're shameless. We really are.
I love it.
Yeah, you do what you got to do, my friend. Let's see. Hi everybody. Hi Karen. Hi Linda. Hi Jonathan. Are you still Burke? He's Burke.
No kidding.
He's broke.
That's pretty cool.
Yeah, we're all broke. I think he means broke. Yeah. And anyway, so with regards to everything you told that gal on the phone, I think it's something I need to be doing.
Yeah, well, it's easy. Okay. Well, yeah, you want it out of there. Okay.
I want it gone.
You want it out. Okay. Chronic bronchitis is a real bummer.
Yeah.
But you have to start looking at the things that are causing it. Okay, because they have to go away. Otherwise it will persist.
Dang it.
But
persistent pertussis.
Pertussis, okay, is an interesting problem. The CDC recently, like within the past 2 years, has been putting on these advertisements, which shows these grandparents going in to seeing their kids, and then they change them to look like wolves. Okay, which is kind of what this is all about. Why? Because because it's like the big bad wolf. Here they both are. So I ended up getting a pertussis inoculation when we had our 2 most recent grandchildren. So Tess and I went in there and we got our DPT. DTaP is what they call it now, but it's actually DPT, diphtheria, pertussis, tetanus. It cost me $65. It's great. Now you're going to think, well, gee, I had these inoculations when I was a kid. Congratulations, you made it through childhood. They only last about 10 years. So you can carry pertussis for decades. It is an awful, awful disease. It can lead to neurological problems, cardiac issues, and it's not a big joke just to be coughing for the heck of it. But the other thing that's kind of interesting, okay, because a lot of folks get misdiagnosed with these sorts of issues, and so, but they'll be given inhalers, which tend to make things actually a whole lot worse if you use them the way they're prescribed. So I'm going to give you a steroidal inhaler. You're going to feel better right away. And you do. It lasts about 6 weeks, sometimes 8 to 12 weeks, then it starts to decrease. And if you don't use it, then you get sick again. Now, if you're one of those individuals, okay, you know who you are. Well, I'm taking this expensive little inhaler. Now, not the beta blocker, not the beta blockers, albuterols and whatnot, not that, okay? But if you're taking the steroids, they're best used in the afternoon, Okay, so they tell you, well, take a puff once a day, but they don't tell you when. They're
Yeah.
actually much more effective if you take it between 3 and 6 in the afternoon.
Oh, I had no idea.
Now you do. That's why I mentioned it,
Mike
because I happen to
Pompeo.
know you're on this stuff.
Sorry, Mike Pompeo doesn't want to take care of business. Well, they make me take the Brio in the morning.
Yeah, you do it in the afternoon. It's 4 times more effective.
Oh, great. Okay.
Yeah,
then.
so just wait until 3:30 or 4 o'clock, and then boom,
Change
in
'em.
she goes.
All right. Hey, we have a call, which I think we should take out of the break here.
You're not even asking why that is.
Because it probably has something to do with
Cortisol levels.
Yeah, the cortisol levels in the afternoon.
Imagine that. Now we're talking.
Dang it! I know better. That's just us getting the cue that we need to
Get
wrap
ready.
up the internet. Thanks for joining us, by the way, on the net. Social media rocks. What? No scrubs. Okay. I think I've timed this out perfectly. Okay, so we got Kathy coming up on the phone. Stay right there. Here we go. Welcome back to Stages of Life Radio. We are live taking your calls, your texts as well. 407-422-1212. Or you can text your questions to Dr. David Klein, 23680. You know, Dr. Dave, we should probably go right to the phones. We've got to Kathy. Kathy's from Orlando. She says she's 68 after bypass surgery.
Hello?
Hi. How you doing? Kathy, tell us a little bit about yourself and what's your question for Dr. Klein?
Well, my question is that does blood pressure, as a general rule, or normal, would it change after bypass surgery? If you were on medicine for high blood pressure before you had bypass, afterwards, is it normal to be taken off of that, or is that abnormal?
Okay, there's nothing normal about having that type of heart surgery. Okay, lots and lots of things change, okay, and they may change for a matter of months. Okay, and that's just the way life is. It's not just the fact that they opened your chest up. Okay, and it's not just the fact that they flipped back the membrane surrounding the heart, which is where an awful lot of the innervation comes from. It's not just that they essentially killed you for a period of time while they revascularized their heart. So the anesthetic that's given wreaks havoc with your autonomic nervous system. So with vascular surgery, you will see vascular changes. People go in without having had blood pressure issues and then coming out and needing them for some period of time. Now, most everybody that comes off bypass is on usually, at least the many times that I've done heart surgery like this, you're on 4 drips. And one of them is to beat the heart into beating a little bit harder. And then 3 of them are to control blood pressure. So the blood pressure control after coronary artery bypass is sometimes a challenge. It certainly is in the first 24 to 48 hours. After that, the body usually mends on its own. But it's not uncommon for blood pressure issues to follow and to be mended by this type of surgery. It's like a big reset. So if you're worried about not being on your blood pressure medications, I wouldn't worry too much about it, but I wouldn't forget that they may become necessary because your body is going to start to bounce back. But pardon me, Kathy?
Well, Dr. Klein, this
Yes.
is, almost like six weeks after bypass, and, blood pressure readings such as 108 over 55, 132 over 67,
Yeah.
119 over 58.
Yes.
Is that, and it used to be high. You said high
Don't-
blood pressure.
Kathy, don't worry.
Can it be cured?
Yes. Don't. There's no such thing in medicine as cured. You can, okay. You control it. Okay. So no. So I wouldn't give it another thought. You keep at the blood pressure. Keep your eye on it because it can sneak back up on you. But can it go away after this type of surgery? And the answer is yes. Why? Because now all of a sudden your heart is beating slower. Okay, because you're going to start seeing a better ejection fraction. You're going to start seeing an increased cardiac output. So you're going to see less ischemia, and wouldn't you know it, the body is going to start performing a little bit better. Will it stay that way? Gosh, I hope so. What I'm going to encourage you to do, though, okay, is to take your fish oil on a daily basis because it decreases viscosity of the blood. It will decrease the amount of, let's say, failure, the incidence of failure of the grafts. The other thing you want to do is to keep your eye on a parameter called homocysteine levels. Okay, now what's this all about? And it's an indicator of, let's say, vascular inflammation. So you want to keep your homocysteine levels under about 9. And how do you do that? You do that with high doses of folic acid and something called N-acetylcysteine. Dosage of the folic acid is 5,000 micrograms a day. The NAC is 500 milligrams 4 times a day. The worst that will do is lower your cholesterol. Okay? It'll lower your cholesterol. It's pretty impressive stuff. But that's really what you want to be doing. So you're blessed in that you don't have to be chasing it with alpha-2 blockers. Okay? So, you're doing fine. Don't worry about it. Are you miraculously cured? The answer is no. We control things in medicine, but I'll tell you what, in the 42 years I've been practicing medicine, I don't think I've ever cured anybody of anything. All I do is set the wheels in motion for the body to mend itself. So I hope that answers your question.
Yes, the line is now open. You want to check in, 407-422-1212. So, Doctor, you were just talking about, when we started the show, about detoxing.
Yes.
And you were getting ready to tell us the big plan.
Okay, so the big plan goes something like this, and that's to focus on everything and focus on nothing. So if somebody comes in and wants to sell you a big can of a powder to detox your liver, you are about ready to waste your money. 50, 60, 80, $100 on something that's really pretty useless. The best way to handle detoxification is the way your body handles it, which is on a breath-to-breath basis and a day-to-day basis. So first thing you want to do is to keep the tailpipe cleaned out. So if you're one of those individuals, well, I go to the bathroom maybe a couple times a week, but that's normal for me, you have a problem, okay? Because if you can't throw out the waste material through the gastrointestinal tract, it has to go someplace. Where does it go? It goes straight back into the bloodstream. Doesn't end so well. How many times a day are you supposed to poop? And the answer is 3 times a day. That's as a mammal every time you eat. Breakfast, lunch, dinner, thereabouts, you should be visiting the bathroom. If not, you have an issue, and that's how you have to fix it. So one of the best and easiest detoxes is to use an old-timey one. This is like $12 a pint. This stuff is called castor oil. And you take a tablespoon of castor oil in orange juice, and it will loosen up your GI tract so that you'll actually evacuate better. I prefer to use a combination of CLA and flaxseed oil, but it costs about $35 a month. Why? Because I really don't like castor oil very much. Okay, what do you do about the liver? The liver is a marvelous organ to detox. Most of what it dumps into the bloodstream is clean. But that which it isn't, it actually dumps through the bile into the small bowel, and that goes through the large bowel and out. So you have to make sure your bile, your gallbladder, is cleared out. Now, I didn't learn this when I was in medical school, but you can, in fact, clean your gallbladder out. How do you do this? It gets back to the same stuff that I mentioned to a gal just a few minutes ago. N-acetylcysteine, or NAC. Guaifenesin. Why? Because it's a mucolytic. It makes the bile thin. High-dose folic acid. Folic acid is one of the body's most important methylators. It's a detoxification machine. So for $4 a month, taking hyperfolate, which is our brand of the 5,000 microgram folic acid, it does wonders for folks. No money at all. And then we're going to go ahead and we're going to start talking about how you get the kidneys to clear out and how we get the lungs to clear out. And then you look at it as one big symphony. So we're going to take a call right about now.
Yeah, we sure are. Rob is on the horn from Deltona.
Cool.
And Rob, it says here that you got prescribed a statin and you're a little concerned. You are 65 years old. Is that correct?
Yes.
Okay. So Rob, which one are you on?
It's called
atorvastatin.
A-T-O-R.
Yeah, atorvastatin. So they're giving you atorvastatin for what reason, Rob?
Okay, I just had some blood work done. Everything was within normal limits, kidney, liver good, urine, all that. But my LDL was elevated.
How high was it?
And it caused it was 200.
Okay, that's pretty elevated. How high was your total cholesterol?
I didn't get a copy. That reading pushed it over into the higher mark. Everything else was good.
Okay, because here's the problem with the LDL. All right, and this is a problem for me also in my clinic, my laboratory, across the board. There seems to be an issue with the assay of LDL. Okay, about 95% of the people coming through my office have an elevated LDL, even if their cholesterol is under 200. Their cholesterol comes in 180. They'll end up with an LDL of 140. That is physically impossible. So I've seen it coming out of my lab. I see it coming out of Quest. I see it coming out of LabCorp. I see it coming out of Vista. I see it coming out of a bunch of them. It's all the same. So there seems to be some issue with it. What I would do before I would put you on a statin would be to go ahead and redo the total cholesterol and then do an HDL and a VLDL, and then you can calculate the LDL from that. So if there's a problem with the assay, it's a simple matter of arithmetic. You can pick either one or the other, either LDL or HDL, and then you subtract that from the total cholesterol. The VLDL is usually in the 15 range anyway, so it doesn't even hardly matter if they forget to do it. And then you'll know if you really have a problem. But putting people on statins is almost always a problem because it deprives the body of a bunch of things. It deprives the body, at the very minimum, of CoQ10. So it causes muscular issues and nervous issues. So go ahead and take CoQ10, but we're going to pick this up on the way, on the other end of this mention.
Okay, we'll take a break. We got to check the news at the bottom of the hour
Thanks,
here.
Doc.
My pleasure.
Good stuff. Thank you so much for checking in and hanging out with us today, too. I mean, you have options, but if you want to learn, you want to get the job done, this is the place to be right now. Stages of Life Radio, brought to you by Stages of Life Medical Institute in Longwood. I am Melissa Fox, and the guy with the brains, that's Dr. David Klein. StagesofLifeMedicalInstitute.com, or give him a call at 407-679-3337. We're clear.
It's actually very interesting thing. So we're going to pick up that discussion
On the other side?
on the other side.
Okay.
But what's cool about this, okay, and being able to do lots and lots of these lab studies is you can pick up when there's a problem like this. You know, when you start saying everybody, I mean like everybody coming through with an issue, you know there's got to be a problem with the laboratory.
Right.
And, you know, what do you do? How often do you actually get a call from the lab that says, gee, we need to bring it back in and redo the lab work? The answer is just about never. Okay?
That?
Yes. So what are we looking at?
What are we looking at?
So CoQ10, it's a big deal. You know, we're going to go out there and we're going to send you to the store, and you're going to be buying CoQ10 because you're on a statin, and that's going to fix things, right?
No.
Not necessarily. What happens when you give somebody a statin is it causes this chain reaction. It decreases the 150 different adrenal steroids that you have on board. So what's neat about it is that depending upon when you ask the questions is when you start picking up on the pathology. Issues with memory dysfunction, cognitive dysfunction, sleep dysfunction, let's say erectile dysfunction, depression, inhibition of the immune system. All of these things happen as your cortisol levels decrease, aldosterone levels, androstenedione, DHEA, testosterone, estrone, as well as progesterone. All of these things drop.
All the runs.
All the ones. They all drop when you take these statins. So it is not necessarily a very healthy thing to be poisoning one of the body's main metabolic pathways.
No.
If all you have is one piece of lab datum that says that there's a problem. Think about that. Everything else was normal except this one thing.
Yeah,
So I'm going to go
that's
ahead
what got me
and I am
there.
going to poison your butt.
And then when he said the LDL was 200, I'm like, well, what's the rest? That can't be. That,
No, I don't think so. You know, I would imagine that his total cholesterol was in the 220 range.
By the way, a takeaway from this is get your lab work copies. Always get your lab work.
Walk away with it. I
Yeah,
mean,
walk away with a copy of it because someone else might be able to look at it like Dr. Dave and poke holes through it.
it makes a difference. Well, I have people coming in and they'll bring me just what they think I want to see. And I generally say, well, thank you very much for putting blinders on me.
40 seconds.
Can't do it. So there's a whole picture that gets painted here. I want you to imagine looking at the world through binoculars. Then flip them around. Look through the wrong side. Makes it very, very difficult to see the big picture
No, that's
because you can't.
All right, now if you want to finish up what you were talking with the last gentleman, I do have another guy on the line who is.
Yeah, let me finish up and then we'll go ahead.
Okay,
and we'll
yeah,
take
because this next guy will tie into detoxing him.
piece of cake.
But that was Rob Pryor who was worried about the statins. Okay, 10 seconds. Thanks for watching us
Carly Simon?
all way, all day. That's correct. Welcome back to Stages of Life Radio. We do this every Friday afternoon from 4 until 5 p.m. on News Radio WFLA Orlando. I am Melissa Fox. Yeah, you know me from Good Morning Orlando. But I'm also here with the weekend expert, Dr. David Klein.
Yeah, so in the morning she's Bud's straight person, and in the evening, afternoon, she's mine.
That's right.
It's all good.
Oh, good, Ollie. We love it. Anyway, if you don't get that reference, you're not young enough. So we were talking, Dr. Klein, just before the break with Rob from Deltona. He'd just been prescribed a statin, and he was kind of wondering about why and should he be concerned.
And I'm wondering why he may have been prescribed it anyway.
Indeed.
So what happens is you're looking at otherwise a normal individual and one abnormal lab value. Now, the first thing, generally, you double check your work before you start changing somebody's life's functions.
A statin is not a.
It's not benign.
Yeah, it's a life changer.
It is not benign.
Yeah.
So not only will it deplete the body of CoQ10, okay, until recently, until very, very recently, many of the in the medical community denied that actually happened at all. Now, Merck has a patent on the co-administration of statins with CoQ10. So they do, in fact, know that it's going on. So if you're taking a statin, you're not taking CoQ10, that's an issue. But what I'm finding, and what a lot of other people are finding as well, is that when you take the statins, it lowers a hormone called pregnenolone. Pregnenolone is also known as the memory hormone. So if you're over the age of, let's say, 60 and you're taking a statin and you're wondering why you walked into the refrigerator instead of walking into the living room, check your pregnenolone level. Okay. Check your cortisol, DHEA. Okay. If you're wondering why you're watching Oprah and crying, check your estrogen, progesterone, testosterone, because all of these things take a tanking when you're on the statins.
Oh, boy.
So is that a good thing or is it a bad thing? I don't see it as a particularly good thing.
That didn't sound good.
No,
I mean, the
more
few
so.
things you just said.
Yeah, so if your LDL is in fact elevated, there are a dozen or more things that are easily done to bring down total cholesterol, which includes LDL and VLDL. There are lots of things that you can do nutritionally, nutraceutically, to have the same net effect without making yourself stupid in the process, or impotent, or whatever else it happens to be.
Statins are
They're
for the most part,
dangerous.
they're dangerous. So you should always at least get a second look, you know?
Yeah, measure it twice before you go ahead and do things. So LDL is a funny thing, but 80 to 90% of the people, 90, 95% on some days, will come in with normal cholesterols and elevated LDLs. That cannot be, quote unquote, normal.
It sounds like someone's reading the paperwork wrong.
No, actually, I think it's the assay. So what I'm going to start doing is moving away from measuring LDLs and just doing HDLs and doing my own arithmetic.
All right. Well, what is the good cholesterol, real quick?
The HDL.
Okay, the HDL.
So is there anything good about it? If you have too much of that, it's no good.
No, it's not
So
good.
everything in moderation. So is oxygen good?
Yeah, but not too much.
Not too much. Is oxygen bad? It depends. So what it works out to is too much, too little are equally bad in most biological systems. So when we get back to detox, which we're going to do with this next call, I understand.
I think this phone call is going to put us there. David from Kissimmee is on the horn, worried about chronic constipation. He's 73 years old. Hi, Dave. Hi, David.
Earth to David.
Oh.
How are you
You
doing?
okay?
What's up? You're on the air.
Okay.
Yeah, I suffer from chronic constipation, and I take laxatives sometimes. And I'm wondering what effect that's going to have on me and what else I can do to solve my constipation issue.
All right, piece of cake. First thing you need to understand is that when people have constipation, it's not a fiber issue. That's not the problem. It's not a probiotic issue. Not the problem. It's generally a shortage of dietary oils. If you don't eat enough of the oils, the stool tends to harden. And you're going to wonder, well, what am I talking about? The colon has one function, and that's to desiccate, to pull water out of the stool. So the longer it hangs around, the drier it gets, the more constipated you become. But the colon cannot take oil out of the poop. So if you take enough or the right kinds of oil in your diet, it will make it down to the colon and act like mayonnaise to a submarine sandwich. Things will glide their way out. So what do I have my patients do? For starters, I'm not really crazy about having people have chronic constipation. It causes things like colon cancer, causes all kinds of problems, not the least of which is hemorrhoids if you have to bear down. So the two oils that I prefer and taken on a daily basis, they will cause no trouble for you if taken on a daily basis. One's called CLA, that's Charlie Lena Alpha, conjugated linoleic acid. The dosage there is 2,000 to 3,000 milligrams twice a day. That's 2 gel caps in the morning, 2 in the evening. Yeah. Not too tough to do. Don't get the liquid. It tastes terrible. Get the capsules. They're not bad. And then you take flaxseed oil, not to be confused with flaxseed. Flaxseed will have the exact opposite effect. But 2 gel caps of flaxseed oil at bedtime. So CLA at breakfast, CLA at dinner, and then flaxseed at bedtime. You do that. Generally speaking, after a week, 2, maybe 3 weeks, things will start to work better. Can you take more of the flaxseed oil? Absolutely. Can you take more of the CLA? Absolutely. But start modestly and then go slowly with it. Castor oil is an interesting one. It doesn't absorb at all. It's an anti-inflammatory and an antibiotic. But when you take a tablespoon of this every day, it will act as a lubricant, a very, very good lubricant. Now, at 72 years of age, chronic constipation, what will happen is your colon will stretch out like an old sweater. This is a problem because the muscles that surround the colon become less and less strong as they stretch out. And if that doesn't make sense to you, I want you to imagine that you have a barbell in your hands. If that barbell is at 45 degrees, it's very easy to bring it to your shoulders. If that barbell is at your hips, it might be a whole lot harder because the muscles have stretched out. They've lost their mechanical advantage. So when the muscular layers of the colon stretch out like that, they weaken. So it takes time. It takes a lot of time for things to correct. So it may be a year, maybe 2 years before you're going to start getting more normal with it. But there's nothing like the present to start. So, in summary, CLA, 2 capsules, maybe 3, twice a day. Flaxseed oil, 2, maybe 3 at bedtime. That should do the trick. If you need a little extra push, then you can use the castor oil in the morning. Never do it at night. Okay? A little warning with this one. The other thing that's sometimes helpful is a very gentle propulsive called enteric-coated aloe. Now, why does this stuff work? It's a little gentle stimulant to push things along. But you have to be careful with most laxatives because they do damage over time. So I hope that answers your question. This is just the sort of thing that we deal with at Stages of Life on a daily basis. If you need to look at if you want to see what the products look like, okay, go to stagesoflifevitamins.com. That's stagesoflifevitamins.com. And up in the little search thing up above, type in flax. So that flaxseed oil will pop up. Type in CLA and CLA will pop up. And then if you go down through the little discussions, the audio files, you'll hear a lot of these same discussions. I've been using these products in this manner for the better part of 30 years. Does it work? And the answer is yes. Okay. And, when do you need to concern yourself with it? And the answer is like right now. Okay. It doesn't do you any good at 72 to be constipated.
Yeah, that's not. No, although I will recommend my Irish, or my Italian grandmother's recipe. Recipe. Yeah, it was pretty much what it wreck you up. It was the onions and pepper sandwiches.
Oh God.
In an olive oil.
Yeah, but to keep you from dating.
Well, keeps you from dating, but it also keeps your colon blow.
I used to have a fiber product that we called Poopy Plus.
Oh,
the FDA took my name away from me.
And sometimes these things make sense in retrospect.
Yeah, well, I got the call. They said, no, Dave.
Not going to do that.
You got this one past us the first time, but forget
my goodness.
Now I'm on their short list.
So, anyway, we're talking about detoxification and keeping a good amount of oil in your the Mediterranean diet is proof of that.
Oil, that's what this is all about. Mm-hmm. So what is the main oil in the Mediterranean diet? It's olive oil.
Extra virgin
olive oil. If you can find a virgin in this country. So extra virgin olive oil tastes good. It's great. I have patients that, I don't want to take fish oil because fish have soul. They're going, no, wait, soul is a fish. Okay, let's understand.
Wait, what?
Yeah, well, they won't eat living creatures. I personally believe that plants have more character than many animals. So what do? They take a shot glass of olive oil every day.
There's nothing wrong with that.
Nothing wrong with that at all. So down she goes. So what would I do? I would float that maybe on some Kahlua. Looks like an oil slick. Works out very, very well.
Yeah, I'm not a fan of butter. I like to cook in almost everything in the extra virgin olive oil.
You do not need mayonnaise. Yeah. You just use olive oil. Yeah. So olive oil is great stuff.
And it'll keep the shoot working too.
Yeah.
It's going to put it out there.
It does.
StagesOfLifeMedicalInstitute.com. There's a directory there where you can find all of the wonderful information that Dr. David Klein is talking about at this moment. We also have the rapid testing still available, the rapid turnaround COVID PCR testing. The average is 36 to 48 hours. And for information on that, FloridaLaboratoryAnalysis.com. Again, FloridaLaboratoryAnalysis.com. They do have a COVID hotline, 407-636-3945. Again, the COVID hotline is 407-636-3945. We're going to have some more of your questions in just a moment. Going to take a quick break. Support our sponsors, including the pharmacy specialists. They are awesome and work hand in hand with Stages of Life Medical Institute. I am Melissa Fox along with Dr. David Klein, and you are listening to Stages of Life Radio on News Radio WFLA Orlando. This is a very short break. It's like 2 minutes, so. Because I can. All right, so let's do some math. 5 and 48. There we go. I believe Dave and John are in the other room. I heard Emma. So, all right. Dr. Klein for Surgeon General, it says on the text line.
Oh, there we go.
Wow.
Oh, that would end badly.
Yeah. Yeah, I was going to say, you were close enough to doing that anyway. What happened?
I did my 12 years. I was up for 06. That's not close to being Surgeon General.
Yeah.
But yeah, it takes a certain kind of person to be in the government for very long. I've got to tell you that. You know, you've got to have your tongue stuck someplace. I'm not sure exactly where. So no, I just want to be out the door. I couldn't take it anymore. Now, going in as a volunteer was great, because you could leave pretty much any time you wanted to. Yeah, just say, okay, I'm tired of this game.
I'm
out
done.
Here. So then they treat you differently. I had the best job in the Air Force, followed by the best job in the Navy. Why? Because I didn't owe them anything. They didn't pay for my education. I went in after I was fully qualified. So it was a great time. Would I do it again? The answer is absolutely.
Yeah.
You know, it was a blast.
Cool. I like your flight jackets and stuff. You can see all of that at the store too.
I got if my helmet would have fit in there, it would have been pretty cool.
It's too big for his big old head.
It was. Actually, try to find a Kevlar cap for 7 7/8.
Really?
Yeah, it's tough.
I think my head's that big too. I remember having a big old melon when they were putting the old steel pot on me in the Army.
Oh man.
So Karen says she wanted to know if it was a smoke at Flanagan's, it probably was getting my.
Could be. You never know. There are lots of different kinds of smokes, and they all do damage.
Dang. All right, stand by. We're getting ready to come back. We got a final segment here on the radio. And, yeah.
Good, too.
It is true. All right, let's see what we got. Welcome back to Stages of Life Radio every Sunday afternoon from 4 until 5 o'clock with Dr. David Klein. He's the man, he really is. Stages of Life Medical Institute's in Longwood, Florida. As he likes to say, it's a piano's throw up of I-4 at the Longwood exit 434. Mm-hmm.
Yep.
And new patients, you can always check in at 407-679-3337.
You betcha. And ask for Iris.
Iris, yeah.
She will take care of you. You've got to be nice to Iris.
Yeah. You got to get past Iris. It's more like it.
She is my moat.
She's the gatekeeper.
The gatekeeper.
Well, you know, because everybody and their mother wants to come and hang out with you once they hear your radio show and your depth of knowledge and such. So, you know, we got to have somebody at the door that's like,
well, she's good.
No, she's very thorough.
Yeah. And so she'll go ahead and she'll help you find out whether your insurance is covers this, that, or the other. If it doesn't, what it costs to come in. Because about a third of our patients have insurances that we do not cover. You know, so like one of the biggest wastes, is to spend money on something and not get your value out of it. Mm-hmm. So, but you don't take X, Y, and Z. No, they don't take me.
Yeah, there's a
big difference.
Big difference.
Yeah, I've been doing this over 40 years. I've been here a lot longer than many of these plans have been around.
You got a question for the doc? Let's get the line out here. 407-422-1212. 407-422-1212 or text 23680 like this gentleman did who said Dr. Klein for Surgeon General. And you don't want to be Surgeon General. No, I'm good. But we've been talking about detoxification, not just cleansing out your wallet, by the way, with useless things.
Very, very basically, yes.
Yeah, but basically how to keep your system working properly and why you do occasionally need to detox. Are there signs? Are there things?
There are places and there are times when your body needs a little bit of a kick, but you rarely need to do anything dramatic to clear out the attic, to clear out the basement. When you hear that, you're talking to somebody who's very, very sick, or you're listening to a doc or whomever that doesn't really know what they're talking about. So detoxification needs to be done on a day-to-day basis. what does this mean? Well, first thing is you don't want to do unnecessary things to do damage to your liver or your kidneys or your lungs or your intestines or your skin. Because when you put an extra load on them, you have to do a little bit extra to get rid of them. So drinking too much alcohol is always a problem because it clogs the liver up metabolically. It causes difficulties. The liver is a marvelous machine for clearing things out. But when it sees an immediate threat, it will tend to focus on the immediate threat. Then there's another nifty little thing that's a lot like a supercharger on a car. So when you give alcohol to the liver, it supercharges the development of other chemicals that can cause cancers. So you got to be very, very careful when you're doing things that increase the development of something called the smooth endoplasmic reticulum, which is a portion of the cell within a hepatocyte that generates things like carcinogens. There are things that you'll do that you think are extraordinarily healthy, happy, especially if you're from California, and it's called grilling. So when you end up grilling things on an open flame, you end up creating benzoadioxins. These are some of the most potent carcinogens and teratogens known. So why would you want to be building up things only to go out and spend a lot of money to detoxify yourself? It makes little or no sense.
Yeah, that doesn't make a lot of sense.
High-dose folic acid, $4 a month, is one of the most cost-effective things that anybody can do. It's the cheapest thing we have in our office at $4 a month. Outrageous. Okay, it's 5 times the prescription strength. Why are we able to do that? There's a little hole in the law, a loophole is what they call it sometimes, which allowed us to be able to get by doing that. And it's just a remarkable value. So this is something that I have everybody on. N-acetylcysteine, I put anybody who's willing to listen to me on it because it clears out the pancreas, which is an organ that we've just care little about, but we really, really
Very
should.
neglected organ.
Very important organ. But it's a maintenance item. So if you're going to go ahead and add an oil additive to your car, and you're going to go ahead and spray the hinges on your house, and you're going to go ahead and winterize this, and you're going to summerize that, you got to do this for yourself too. Okay. These are preventive maintenance type items. And are they expensive? And the answer is no. So on a monthly basis, what should you budget for detoxification nutraceuticals? The answer is about $65. Why? Because if you pick them properly, they're doing 4 other things. So the folic acid is helpful. It's the only thing ever been known to reverse plaquing of the arteries. So we do that for folks that have arterial sclerosis, like clogging of their arteries in their neck. We do our own ultrasounds in the office, and we can watch the things start to decrease. My calcium score, those of you that have had this done, is 0. No calcification in the arteries of my heart.
Don't hate on him.
No. This is pretty impressive. I do this myself. This is the way it is. Fish oil reduces your risk of heart attack and stroke, but it is a marvelous medication of detoxification. Something you should be doing anyway.
Little fish.
So these are the sorts of things that if you understand the nature and the mechanism of detoxification, you realize that if taken the appropriate doses and then schedule, you get more bang for your buck. L-theanine clears the liver out. Great stuff, but you use it if you have insomnia. 1/3 of the population can't sleep. So you take L-theanine. It's an amino acid, and it's a detoxification agent. Brilliant choice for somebody that can't sleep well. So each of these medications can have more than one benefit, and if chosen correctly or chosen intelligently, you're going to get multiple systems corrected with it. That's what it's all about. If you want to go to the big box store, ask the kid with the acne what to take. You know what I mean? So people say, well, what do you do? It's not what I do, it's what I think. It's what I know. You look at things, I've seen this puzzle before. It's not going to take me very long to figure this out.
Okay.
You're not paying me for my time, you're paying me for my knowledge.
All right, Doc, we got Karen on the line here.
Karen.
And she has some questions about one of your favorites. It's a vitamin, but it's not really a vitamin.
It's
Vitamin D.
cholecalciferol. Brought to you by...
Karen, so you wanted to know if it can be taken separately from other vitamins? Yeah?
Vitamin D?
Yes. Okay, so vitamin...
Oh, yes. I have heard that you should not take it with other vitamins or minerals, and also it should only be taken at a certain time of day. Is there any best way to take it?
Nope. Okay, here's what it is. Vitamin D is not a vitamin. It's a hormone. It's lipid soluble, which means that it should be taken with oil. It can be taken any time of the day. It really doesn't make any difference. It's a selective estrogen receptor blocker as well. It reduces your risk of cancer by about 50%. What I would suggest that you not take it with is something called calcium. So when they give you calcium with vitamin D, that's like taking a penny and sticking it in the concrete sidewalk out in front of your house. It's not easily taken out. So it's not so much that you can't take it with other things, it's the preparations themselves are sometimes a problem. The dosage of vitamin D for most adults is about 5,000 IUs. That's a lot. It is not going to be present in that dosage in your multivites. It's not going to be present in that dosage in your calcium with D. So take your calcium if you think you need it. And the one you want is called calcium hydroxyapatite, not calcium carbonate, not calcium hydroxide, but calcium hydroxyapatite. Take the vitamin D as a separate capsule, but simultaneously with a fish oil capsule. If you do that, you're going to do fine, and don't worry about what you're being told about taking it at certain times of the day because it doesn't make any difference whatsoever.
Well, there you have that. 407-422-1212. That line is open, but it looks like the phone's ringing off the hook, so we'll have to take that call in a second anyway. All right, so this is Stages of Life Radio. Dr. David Klein is one heck of a doctor.
I'm a heck of a guy, actually.
You're a pretty all-around guy, yeah, and not modest at all.
Never really.
I mean, not at all modest, Karen, by the way, just was checking in on social media. She said that Iris is cool.
Iris is okay. Iris is she has the hardest job in my practice.
Mm-hmm.
She is the only person at the front desk, so she's juggling chainsaws out there all the time. Now, Iris does the work of 3 people in my office.
I'm not sure why that is there, but it's a pretty nice song.
It's cool.
I know what it is. It's time for us to go. Already? Oh.
Alrighty. Well, we'll be here next week.
Next Sunday, 4 o'clock. Yep. Stages of Life Medical Institute.com for more information on anything we've spoken about today. Doctor, say goodbye.
Adios. Good to be here.
You've been listening to Stages of Life Radio with Dr. David Klein. Check out stagesoflifemedicalinstitute.com or stop by 1917 Booth Circle in Longwood near the intersection of I-4 and 434. Call 407-679-3337.